My name is Ann Lee, and I am the Programs Associate for CAN-DO Multiple Sclerosis. And thank you everyone for attending tonight's webinar on Managing Speech, Language, and Cognitive Challenges presented by Pamela Miller and Janet DeClark. CAN-DO MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. We empower people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors and actively co-manage their disease and live their best lives as possible. We can learn more about our programs by visiting our website at www.mscando.org. You can register for upcoming webinars. You can also listen and view archived webinar recordings. And you can also learn about our in-person programs, such as our CAN-DO program, which is our flagship 4-day program that's held once a year, our Jumpstart program, which is our 1-day program that's held 5 to 6 times a year around the country, and our new Take Charge program that's held a few times a year, and that's 2.5 days. You can also search and connect with us on social media. You can like us on Facebook and find up-to-date information regarding our upcoming programs and events. And also please remember to share your CAN-DO pledge on our Facebook page. You can also connect with us on Twitter and receive the most up-to-date tweets about the most recent happenings with CAN-DO MS. And you can also find us on YouTube and browse through our webinar recordings and archives and other fun videos. Connect with us on LinkedIn to find out any information regarding our organization as a profession. And also find us on Pinterest to browse through CAN-DO MS's bulletin board of photos and fun ideas. And just a few housekeeping items before we get started. As it was mentioned earlier, we will have a Q&A session at the end of the program. To ask your questions, you can post your questions by typing them to me in the chat feature that's located on the left bottom hand corner of your computer screen. Just type in your question and hit submit. And we will be able to address those questions at the end of the webinar. This presentation is being recorded and will be archived on CAN-DO MS's website. All of our monthly webinars are archived on our website, and you can view them again at any time. Those of you who are attending tonight's webinar will receive an email with copies of tonight's PowerPoint presentation. And also please complete the evaluation that will be presented to you at the end of the webinar. We value everyone's feedback. I'd like to now introduce our presenters for this evening's program. Pamela Miller earned her master's degree from the University of Denver and has provided evaluation and treatment for the speech, swallowing, and cognitive language problems of neurologically impaired adults and adolescents since 1976. Her MS-related clinical experience includes Director of Speech-Language Pathology at the Rocky Mountain Multiple Sclerosis Center, consultant for the Jimmy Huga Center, which is the CAN-DO Multiple Sclerosis Programs, and the MS and also the MS clinic team member at the Denver VA Hospital, where she is currently practicing today. Ms. Miller has presented nationally on treatment of cognitive communication disorders, dysarthria, and dysphagia in MS, and she has also written several publications on these topics in MS. Janet DeClark is a speech pathologist at Valley View Hospital in Glenwood Springs, Colorado, and is a program consultant with CAN-DO MS. She has 30 years of experience working with individuals with multiple sclerosis, Parkinson's disease, brain injury, and stroke in acute and post-acute inpatient rehab, outpatient, and home health settings. She is certified in neuromuscular electrical stimulation for dysphagia, is a registered clinician for the Modified Barium Swallow Impairment Protocol, and is certified in LSVT therapy. Janet and her husband have 3 grown sons and live in Edwards, Colorado with their 2 labs, Lexi and Oliver. And I'd like to now welcome Pamela Miller and Janet DeClark.
Thank you.
Yeah, thank you very much. This is Pamela. Janet and I are both very happy about speech, language, and cognitive challenges in multiple sclerosis. We will be breaking it into a couple of points, and I will cover speech and voice, while Janet will cover the language and cognitive pieces of it. When we think about speech and language, and we think about communication and cognition, there are types that people with multiple sclerosis may experience awareness.
Uh-oh.
Being able a clear voice, some has changed, maybe a little breathier or have hoarseness or voice quality. Changes in their language, not being able to come up with the words that they want to say. Vocabulary is not quite as good. Being able to keep up with understanding what people are saying. So those would be the language components, understanding what we hear and read, being able to express. And lastly, the thing is that can occur. I'm talking now about the cognition, and that would be paying attention, having difficulty paying attention, having difficulty learning new things, remembering new things. These are just a couple of examples of thinking skill problems that Janet will go into more detail later. But I guess the most important thing is if you're having difficulty in any of these 4 areas, just know that it's a speech-language pathologist who you would ask your physician for a referral to so that we could evaluate, we could make recommendations, we could refer to other specialists as needed, we can provide treatment, therapy, different strategies. But what I'd like to do now is actually do a poll right now, and I'd like for each of you who has multiple sclerosis to indicate if you are having difficulty with speech. If you're having difficulty with speaking clearly or loudly, if you would indicate that. And Anne, I don't know if you could give them instructions about how this is done.
Sure. So I'm able to see people actually logging in their poll, and I can now skip to the results. And here are the results of that poll.
So do I hit skip to results?
Yep, so it looks like that we have 77% that have indicated that they're currently having difficulty with cognition. And then we have 43% that are having difficulty with their speech, followed by 31% having difficulty with language, and then 23% having difficulty with voice.
Oh, that's very interesting. Let me just write some of those things down here, 32% and 80%. Wow. That's very interesting because it looks like we have about 150 people replying or on the web, and maybe 120 are replying. And that's very similar to what we see. The speech problems can be up to 40%. Language problems, as far as I don't have prevalence information on language problems. I don't know if Janet does, but voice problems are things that people don't really typically look at. And I'm very interested in that area. And 20% of you all have noticed a change in that, whereas the vast majority, of course, have noticed cognitive changes, and that goes along with what we see in the literature and in clinical practice. So let me talk about speech just a little bit more. So speech, we talk about that as motor speech disorders, and the fancy term for that is dysarthria. Just like you can have weakness, slowness, and incoordination of any muscle group in your body as far as walking, using your hands, you can also have that in your lips, tongue, soft palate, depending upon where the MS lesions are in your brain, and that can affect how clearly you speak. A lot of people say that they do fine unless they have fatigue, and that's when the slurring occurs. So dysarthria in MS, what you'll notice mostly is that you might not be able to speak quite as loudly as you used to. Your breath support might not be quite as good. Your speech may be slurred. You might have imprecise articulation. It takes you a little longer to speak. You might not flow. The conversational flow may not be as even. It might be a little jerky or have pauses that were a little longer than you've ever had before. As far as the melody and intonation patterns in your voice, maybe you have monotone and it seems kind of flat, or the stress is very excess and equal stress whenever you're speaking. And all of this can go into the naturalness of your speech. It may not sound as natural as it did before. And the bottom line is it intelligible? Somebody's speech may not be precise, it may be slurred, but it could be intelligible. It could be understandable to other people. All right, there we go. And so how do we evaluate these problems? If you saw a speech pathologist, the very first thing that we would do is to do an oral peripheral examination. We'd get out the mirrors and the flashlights and take a look at your lips, your teeth, your tongue, your soft palate, and have you do a lot of different things. One of the things on the motor speech evaluation would be first to see what your breath support would be. And so we might ask you to take a breath, fill your lungs, and say ah for as long as you can. People normally can do that for 20 seconds or longer. With MS, it could be a lot less. And so that would indicate a need to work on breath support so that it could help your loudness. The other way one way that we would look at articulation is to see how your lips and your tongue and your soft palate work together. Is we might have you repeat the sounds patika, patika, patika over and over as quickly and evenly as you can, and time how many of those you can do within 5 seconds. People normally can do 10 to 12 within 5 seconds. If you have dysarthria, it could be quite a bit less. Speech intelligibility, we may have you read a passage, we may have you just speak and talk in conversation and have a percentage rating of how understandable you are. Specific sounds and error patterns may be analyzed, and we may take a look at your speaking rate, how good your flow is, and what your intonation patterns. Is it flat? Is it natural? But probably the bottom line is once we figure all of these things out, is we teach dysarthria strategies, because there are many ways that you can learn to speak more clearly. And probably the things that help you the most are to fill your lungs fully so that you can speak louder, then also to over-articulate or exaggerate your speech. Maybe pause strategically, try not to say too many things all at once, and say a few words, pause, say a few more, to allow your lips and tongue to keep up. And it's very important for you to actively self-evaluate, because if you don't hear it, there's not a reason to change. Speech therapy, probably many of the people that I work with at the VA hospital, for example, when they can't come in for their evaluations, team evaluations, all they need are strategies and a home program, and the communication partner, whoever, whether it's a wife or whoever, will learn how to, I could train them to help that person with MS who's having the speech problems communicate more effectively. Sometimes we need more than just a home program and training of the communication partner. Sometimes there's some individual short-term therapy so that you can learn to consistently use those strategies. And as I said before, improving loudness, over-articulating and using strategic pauses are probably the three biggest areas to improve your speech, as well as learning how to use your diaphragm when you're breathing, how to target specific sounds or error patterns if those are found, how to teach yourself to really listen critically so that you can correct yourself, how to so that ultimately you can be understood. Your speech intelligibility would be good, and you can participate in your daily life better, that you can communicate with those in your daily life, whether they're at home, in the community, or at work. Some other considerations during speech therapy is what to do with the communication partner, how to train that person how to best cue you and clarify what the message that you're saying, reinforce the strategies that you're using. Sometimes a consideration is equipment, and if loudness is a problem, portable voice amplifiers are really quite helpful. Some equipment like mirrors and voice recorders to use in therapy or to help yourself at home are also good. Alternative communication, it's rarely needed in people with multiple sclerosis, but occasionally that happens. Some diseases, like ALS, for example, it becomes difficult to even articulate and get your needs known through speech, and so you learn how to use speech-generating devices or use low-tech communication boards. That's not typically a consideration with MS, but know that that's there in case that is your situation. Now if I talk about beyond, we're done with speech right now, but now if I'm shifting over to voice, we're thinking about the fancy word for that is dysphonia, and dysphonia means a voice disorder. And you saw in the poll that there were about 20% of you who said, yes, my voice is different. When we evaluate voice, we look at the quality. We listen to the quality. Is it hoarse, as if you had a sore throat or laryngitis? Is it breathy, as if you had a little bit too much air coming out? Is it very strained, and is there a tremor in your voice quality? Next is pitch. Sometimes people say, boy, my pitch is higher than it was before, it's lower than it was before, or I just can't sing like I used to. I don't have the range, the pitch range I used to. Another is loudness. People notice they may speak too quietly. Some people speak too loud, and sometimes people say it's variable. Sometimes it's loud, sometimes it's quiet, but I do notice also that it fades across time as my breath support runs out. Another thing that we look at in voice is nasal resonance, and that's how your voice comes up above your vocal cords and resonates into your nasal area. And sometimes if there's too much nasality, we call that hypernasality, where too much air is lost through your nose. Hyponasality is not enough is up there resonating, so it's almost like people who have a cold and they talk as like I can do it right now. I talk and I don't have anything resonating. So a lot of times when there's nothing resonating in your nasal passages, it sounds as if you have a cold in your. And the other is just an imbalance where you can go back and forth between hypo and hypernasality. It's important to know whenever you're doing a voice evaluation that we need a team. Not only you with a change in your voice, but also initially, preferably, you would want to see an otolaryngologist or an ENT, ear, nose, and throat specialist, so that they can do a scope exam. Then there's the referral to the speech and voice therapist to help you learn to use your voice better. And sometimes there's referrals to other specialists. this is what it would look like. I don't know if any of you have ever had a scope exam by an ENT, but they would put a scope, whether it's up through your nose or into your mouth, so that they could look down at what your vocal cords look like on the right. You can see on the left, he's doing the scope exam on this young woman, and there is a video up above, so they're actually seeing how the vocal cords are moving and vibrating. On the right, you'll see just a two-dimensional picture of vocal cords, and you can see at the top, and that's what we would look at when you're looking down. At the top, we look at how do they come together. Are they being able to come together fully or not? And maybe if they don't come together fully, too much air is escaping, and that's where the breathy voice quality would be. At the bottom, we look at can they separate, or how well do they separate? And in the middle, it's like how do they vibrate? How do they move together in an undulating motion? And the other important thing, that the ENT looks at is, is there paralysis of a vocal cord? Are there vocal nodules or bumps on there for using your voice improperly? Is there cancer? Is there changes of reflux that you can see redness and swelling? So that's why it's very important for a doctor, a specialist, ENT specialist, to look first. Then what we do is, this is what I had actually gone through, beginning with the scope exam by the ENT. They assess the true vocal folds, which I showed you the picture of, nasal or oral, through the nose or the mouth. They rule out masses, lesions, polyps, nodules on your vocal cords, paralysis, tremor, reflux signs. They look at movement, how your vocal cords close, how they vibrate. They may ask you to sniff. So if you sniff, it actually makes your vocal cords open fully. Do they open fully, they're wondering. They may ask you to say ee, and they watch how your vocal cords come together in the vibration pattern. They may ask you to do a pitch glide to see how your vocal cords elongate and shorten. And then they may have you speak and watch to see, is it just your vocal cords that are moving, or is there too much function, hyperfunction? Is there stress and tension above the vocal cords? If there are, those are things that speech pathologists can help you work with. An ENT might prescribe medications for reflux, sinus problems, allergy symptoms. They may even do surgery. Injections of something like Radiesse would be an example to help with the closure. They may refer for other imaging studies, like to rule out reflux, do barium swallows, CAT scans. They may refer to us as voice therapists to help learn vocal hygiene, how to take care of your vocal cords and the proper voice techniques. And then after the voice therapy, typically the ENT would want to see you back again. So in voice evaluation, what we would do after you would see the ENT is that you would describe the voice problem that you're experiencing. When did it start? How is your voice throughout the day? Did you have any surgeries before? Are you taking any certain medicines that would affect it? Are you having excess mucus or sinus, reflux, allergy symptoms? And then vocal demand. How much are you using your voice during the day, on the telephone, socially, at work? And then vocal abuse, or some people call it phonotraumatic behaviors. What are things that you may be doing that are harmful to your vocal cords, like smoking, or not drinking enough water, or drinking too much caffeine or alcohol, which have drying effects, or clearing your throat and coughing a lot, or speaking too loudly. So identifying all of those things would be important. Then it would be important for you to rate yourself. There's some standard inventories where you can actually rate how that could indicate reflux, could indicate problem, glottic closure index, could indicate that you're noticing problems with your vocal cords coming together. Voice handicap index could indicate that your voice is really interfering with your daily activity, and then the voice quality of life would be interfering with the quality of your life. There are measures that our association, ASHA, American Speech and Hearing Association, puts out to rate voice function. How much does it distract or interfere with communication and with your participation in everyday life? Then a speech pathologist, after the ENT does their thing, we do the interview, you do your self-survey, then we do some actual perceptual assessment and have you read some things, speak, and we would rate, what is your voice quality like? How is your pitch? What do you have the habit of speaking? Your pitch, is it too low, too high, and what is the optimal pitch? Do you have good range? How is your loudness? How is your nasal resonance? We also have computerized speech labs where we can record objectively and measure pitch and loudness so that we can have you see and hear yourself before and after voice therapy. The voice therapy that I typically do is geared to unlearn maladaptive behaviors. In other words, when your vocal cords are not working properly, what you have a tendency to do is to compensate, and people learn to do it in the wrong way. So you have to unlearn those. And the main thing is if you can get your true vocal cords to vibrate and the air to flow easily, as opposed to false vocal cords to vibrate and squeeze, and air to flow easily as opposed to holding back the air, which is what people often do. Those are the two often main goals. And typically it takes 6 to 8 sessions weekly. And the goals typically are first to teach what are good vocal hygiene strategies, and to get many people with voice problems have reflux, laryngeal pharyngeal reflux, which comes up from your stomach into your throat, pharynx, and spills over onto your larynx, vocal cords. After teaching those and stabilizing those changes in behavior, learning how to warm your vocal cords up, to do stretches, to do diaphragmatic breathing, to do progressive relaxation because there's often too much strain. Then we teach proper voice techniques to reduce the vocal strain, to use an easy resonant voice, to learn different things like stretch and slow and safe loudness, and then ultimately to transfer all of those skills into everyday life and everyday communication. So these are just a few things in the areas of speech and voice for evaluation and treatment and strategies. And now I want to turn it over to Janet, who will talk about the language and cognition portion.
Thank you, Pam. Can everybody hear me? I want to make sure I'm being heard by everyone because I had my phone on mute, and I'm not a real high-tech person, so I want to make sure I press the right button and everyone can hear me.
Yes, I can hear you, Janet.
Good, thank you. Okay, we are going to now be talking about cognition and language, and specifically how that relates to MS. So I have this little slide here that says you are here. We are now in the brain, and we'll be talking about all of those things that have to do with brain function. And the first thing I'd like to do is actually define what cognition is. So we all know what we're talking about. Cognition is higher level brain function. So it's how you think about how and what you think. It's the ability to stand back and reflect on your thoughts and reflect on your behaviors and your actions. It's also how you understand and use language, and that is part of this webinar, is talking about language, because language and cognition are intimately related to each other. It involves attention, particularly how we sustain attention, how we move our attention back and forth, and how we multitask and do things simultaneously. Cognition also involves how we learn and remember new information. That's new learning and then remembering what we learn later on, short-term memory. Also, it involves long-term memory, different types of memory. Cognition is also how we plan and perform complex tasks. How do we put things together? How do we prioritize? How do we sequence things in our mind and sequence events and how to carry out a task? And it's also how we solve problems and monitor our behavior and reflecting on something we've done and, well, how did we do? How did I do on that? That went pretty well, it did not go pretty well. That is also cognition. The ability to do that is cognition. So how are cognition and communication related? Specifically, how is cognition related to language? And the way I think about it is you really can't separate them that much. Cognition really is an internalized process. It's silent. And language, whether you're writing it or you're speaking, allows for those cognitive processes and all of those thoughts to be shared. So language really is the verbal, spoken component of what's going on, the cognitive processes going on in your head. With multiple sclerosis, language impairment, specifically as relates to something we call word retrieval, is often a reflection of cognitive challenges. It can be a reflection of problems with attention, some difficulties with memory, sometimes some difficulties with organizing thoughts. A true aphasia can occur. That is literally where you look at a table and you call it the wrong thing, or you absolutely cannot come up with the name of it, or you can't understand what someone is saying, much in the same way that happens when someone who has a stroke. That is rare in MS, but it can occur during an exacerbation. But that is not usually the typical complaint long-term with people with MS. So tonight we're going to be talking about these areas of cognitive linguistic challenges that are common to multiple sclerosis. And we will be doing it in this order. So we're going to be looking at memory, information processing, attention, executive functioning, and word retrieval. And what I'm going to do is I'm just going to present a slide with some of the symptoms of impairments in each of these areas, and you may relate to some of these symptoms. And then I'm going to offer some simple strategies, very general strategies that perhaps you can try one or two right after this webinar and see how they work. And as Pam had said also, if you're having some real specific problems that are having a big effect on your life, then I would recommend that you see a speech pathologist to have an evaluation if you're having language and cognitive problems. And that way treatment can be a little more individually focused. Okay, let's start out with memory. Definition of memory is an impairment of memory can affect learning or acquisition of new information. But sometimes it's not always memory that's the problem. If somebody's having a problem with attention and difficulty with paying attention to what somebody's saying or activities that are going on, or if processing it is slow and it seems like you just can't keep up, that can be perhaps more of a problem. Something that you can't attend to or you can't process quickly enough will never get into your brain to be stored. So those things also have an effect on memory. And perhaps you can relate to some of these issues. Do you have trouble learning or recalling new information? Misplacing items? And again, that's something all of us do. But if you find that these things are happening more frequently and on a more regular basis and it's beginning to bother you, perhaps you want to look at it. Trouble remembering the plot of what was read in books, a plot of something on television, forgetting the content of conversations, having a conversation with a spouse, an hour before and then really not recalling too many of the details or much of what was discussed. Forgetting appointments, that is forgetting to remember something. That's called prospective memory. That's remembering something in the future. Do you have appointments that you space on and you forget about. And well, all of us experience this. Is this happening more frequently? And that's forgetting the purpose for entering a room, where you walk in and you go, you know, I knew that I was in here for something. What was it? So if that's something you can relate to, then perhaps you're having some issues with memory. And there are a few things, I'm just going to offer a few strategies that may be helpful in addressing some memory problems. First of all, combine modalities. And when I think of modalities, I think of seeing, hearing, reading, writing, feeling. Try to combine all of those. Combine all of your senses in order to help store information. For example, if you're having a conversation with somebody that's important and, oh, you know, we're going to have dinner next week at 6 o'clock on Thursday, write it down or have the person write it down for you. So you're not just hearing what they're saying and you're not just discussing it, but then you're also seeing it. Say it again to yourself. So you're repeating it. You're actually saying it and you're hearing it back again. And hearing it again is another thing that can help you store that information. Write it down. So combine all of those modalities, and you combine at least two, and the chances are better that you're going to recall what is going on. Another technique is one that actually goes by many names, but I call it repeat and verify. And an example I give of this is having a conversation with somebody, for example, that dinner next Thursday at 6 p.m. And when you say to the person, oh, so you want to have dinner next Thursday at 6 p.m., essentially you repeat back to them what they just said. And that accomplishes a couple of things. Number one, it verifies that the information is correct. They say, yes, you're right, it is Thursday at 6 p.m. Or they might say, no, it's Thursday at 5 p.m. So it does that. It also allows you to say it and hear it again, so you're hearing the information twice. The other thing this technique does is that it buys you a little time. And a lot of people I work with complain that sometimes information seems to come too quickly, and they have trouble keeping up. And repeating and verifying information that somebody's giving you actually buys you a little bit of time to process that information. Another strategy is spaced rehearsal, or actually a more familiar term is spaced retrieval. This is actually a memory technique where you repeat information or an activity at very time intervals. So, for example, there's going to be dinner next Thursday at 6 p.m. Then you say that back to yourself in 30 seconds. And then you say it back to yourself in a minute. And you extend that period of time in order to store that information and really get it in there into your memory so you can remember it later. And you gradually expand that period of time that you're rehearsing this information. Another thing I know a lot of people do, and I think a lot of people do this very naturally sometimes, is to build associations. And that's making visual or verbal associations between new information and familiar people, names, places. You may remember that there's a restaurant you went to, but you can't remember the name of it. Building an association that, gosh, there was a lot of red in the restaurant, and yeah, it was that red restaurant, and you're associating it with something, and different attributes about that place is going to help you recall not only the place but hopefully the name of it. But if you don't recall the name of it, at the very least, describing something will help your listener to at least understand what you're talking about. So building associations is also a good idea. And the classic one is the mnemonic for remembering names. Robert Bird. And of course you picture a visual association of a bird and a bird named Robert. And that is then going to help you to remember next time you see that person what his name is. So those are some simple memory strategies. And there are a lot more. Again, these are very general, but there are a couple of strategies that don't work very well. And this is one that I know kind of drives me crazy a little bit, and that is the use of multiple Post-its. And when you do put Post-it reminders all over the place, it actually becomes more confusing and increases the pressure on your brain to remember something rather than decreases that pressure. So here are a couple of strategies here that really don't work very well, and that's putting sticky notes everywhere as reminders, because then it just becomes too overwhelming. And that's not real effective. And as you can see here, there's a man who is trying to remind himself that he forgot where he put the sticky note to remind him to go out and buy more sticky notes. Okay, let's move on to information processing. And as I had said, this is also intimately related to memory. It's also very related to attention. And the speed of processing can be affected. That's where something seems like it's coming too fast. Or your brain just kind of gives out and goes, I've had enough TMI, too much information. I can't take in anymore, and you just feel too overwhelmed. So you may be able to process things, you just can't do it as quickly as you used to. So here are some of the ways that can manifest itself. Becoming overwhelmed when information is coming too fast, or there's just too much of it coming from too many different directions. Feeling like you are comprehending something a little too late, perhaps after a conversation or something's moved on, and then you go, oh, now I've got it. And I always call that the marinating effect. Sometimes it takes a little while for information to marinate in your brain before it actually sinks in. Slower processing may feel that way. It can manifest itself in reduced productivity. Being overwhelmed makes you less productive because you don't know where to begin, because it's hard to keep up. And difficulty responding quickly is another manifestation of that. And perhaps one of the biggest problems is having difficulty with things that involve time constraints. When there is a time limit, there's a lot of pressure, and if things are a little slower and just a half second off, it may be more difficult to process information. So what are some of the things we can do about that? Well, number one is that repeat and verify technique, which is a memory technique. It's also a processing strategy. Again, it buys you a little time. It helps you to verify the information. And it's also, especially in conversations, really flattering to your listener and whoever is talking to you. It makes you sound like you're listening with rapt attention. So it's just, I think, a good thing for everyone to do anyway. There are some other external strategies we can use, and not everyone is comfortable with high-tech tools like cell phones and all of that, but if you are comfortable with that sort of thing, email and text messages can offer written records of conversations and can offer written records of information that can be referred to again and again. And I know I have at times when someone has said, here's how you get to the beach. And they start to tell me, and then sometimes I say, can you email that to me, or can you text me that? And then that way, I have that information, and I can just look at it, and I can actually read it again and again and keep referring to it. And that takes some of the pressure off of having to process the information quickly. And it also gives us a backup, so we can refer to something as many times as we would like. Okay, another thing is voicemail. Asking someone to call you if there's something important to be shared. Can you call me and leave me a voicemail about that? That way, much like the text messages and the emails, you can listen to the information again. And certainly I know a lot of doctors' offices these days have either people or computerized voices that will call and remind you of appointments, and very often on your voicemail. And those are good things to keep around. The other thing to do is to try to modify your environment as much as you can. So for example, asking for a repetition of information if you need it. I'm sorry I didn't get that. Could you say that again? Asking a speaker to slow down, again, this can be very flattering to a listener. You really are listening intently. And I think people would be happy to do that, to help you out. And it doesn't mean I have MS and I have a cognitive problem. It really just means I'm having trouble keeping up. Could you repeat that? Could you slow that down a little? So I really want to hear this right. Limiting something to one thing at a time. If there's a lot going on and there's something you need to listen to or process or read, removing yourself from a situation and or dropping one activity when you're doing a couple of them and concentrating on one thing at a time, moving to a less distracting environment are all good things to do. And if you're overloaded, trying to push through that is just going to become more frustrating. And then the more frustrated you get, the harder it gets, and you're really kind of swimming upstream at that point. So really just requesting a break and saying, I've had enough. I've had enough. I need to take a little break. And removing from yourself from a situation for a little while to give your brain a break, to give yourself a break before you step back in. It's also a good strategy to control that processing speed. Okay. Attention and concentration, again, are also very important. And symptoms of attention problems are trouble with multitasking and alternating attention, moving from one thing going to the next, sustained attention, selective attention, and focused attention, which can also be a real problem with MS. And so the way to deal with difficulty with alertness is just respect your fatigue, because cognition and fatigue are intimately related to each other as well. The more fatigued you are, the less cognitively competent you might feel. And then, that's scheduling rest times. And I'm sure you've heard that a lot, but that really is important because it's difficult to do cognitively demanding tasks when you're very fatigued. Minimize distractions. Move to a quieter place. That helps with selective attention. Know your limits and stay within them. Know when you're going to get overloaded and kind of break things down into bite-sized pieces. Alternating attention. Complete one thing. Hold one thing. Move to the other thing before you move on to something else. Say, excuse me, I need to finish this first. Finish something and then go to the next thing. And when it comes to multitasking, the one thing I always say is we have to do that in our society, but we don't always have to do it as much as we think we do. So whenever possible, try to switch from doing 2 to 3 things at a time to one thing at a time. Because the research does show that none of us do anything very well if we're actually doing 2 or 3 things at one time, and that's MS or no MS. That was actually a study out of Stanford in 2009. Okay, executive functioning has to do with organizing, initiating, reasoning and problem solving. That's sequencing and reflecting on things and how to attack a task. And if you have a problem with this, you're going to have a problem with organizing how to attack something, feeling overwhelmed, and you may just throw up your hands and give up and say, okay, I don't know where to begin. So what are some strategies for dealing with that? And the classic ones are consolidate and centralize. Use calendars. Use your iPhone if possible, but keep a large calendar to keep track of appointments, and then have a to-go one where you're writing things on that. Whatever's on the big one goes on the small one. Or if you like computers, do Google Calendar or Outlook, but keep everything in a central place so everybody in the home, all that information is in one place. Make a place for bills, phone messages, to-do lists. I always had a basket. Literally, I would just throw things in there. It wasn't terribly organized, but at least I knew what pile to go to look for them. If you are a techie, either smartphone or tablet, get familiar with all it can do. It's limitless, the options of what you can do to keep yourself organized by using your iPad or your smartphone, especially the calendar functions and the note functions. The key is whatever tool you use, keep it with you at all times and transfer information to and from that home calendar regularly. So you have one on the go and you have one at home. You don't want to have more than 2, tops 3 little devices there to help you organize. The more you have, it can then start working against you. So you really want to keep it to ideally 2. And here are some strategies that don't work real well. The home communication center with everything on the refrigerator. Again, I think a calendar on the refrigerator is great, but sometimes there's too much information on it. Or, this is me here, things at the bottom of my purse. A to-do list, haven't been able to find it for weeks. You have to make it easily accessible and refer to it regularly, and writing something that's going to get buried at the bottom of your purse isn't going to work too well. So let's move on to word retrieval, and I know a lot of you have talked about difficulty with coming up with the right word in conversation. And this is related to the cognitive processes of processing speed and distractibility, or trouble retrieving that word from where it's stored. And it feels like the word is on the tip of your tongue. You know what it is, you just can't think of it right now. Maybe at 3 a.m. you can, but you can't right now. Circumlocution is actually a term used for talking around a word. That's not actually a bad strategy, but if you find yourself doing that a lot because you can't come up with the word you want, then you may be having a word retrieval problem. One of the worst problems that happens with that is people withdraw from conversations. They get so frustrated that they just don't speak as much and they don't converse, and that's not something that any speech therapist likes to see happen. And it does happen more on words that have more content on meeting. And I give an example here of using the word locomotive, trying to think of that word. You can think of the word train, but you can't think of the word locomotive. And that can be frustrating. And here's an example of what circumlocution can look like. You know, that thing, it's one of those, the thing with the fire and stuff. I know I've done this, and everybody does to an extent. So what are some of the strategies we can use for word retrieval? Well, here are just a few, and again, this is just a few. Using gesture, pantomiming. It can often cue the word for yourself, but at the very least, it can communicate the idea to your listener without words. I had a patient who was showing me a digging motion, and I could figure out what he was talking about the activity he was trying to name that he does on his farm. And he did it all without words. Writing or drawing with a pen or a pencil or a finger. I actually had one patient recently, that's how he would cue himself. He would try to come up with a word, and he would just get a pen and he'd start writing the first letter. And then he just started kind of making the letters with his finger. And after a while, that was enough to help him come up with the word on his own. So for him, that was a great strategy. Again, it's very individual, but for him, that worked well. Find a synonym, a word that is the next best thing. That means something similar, maybe not quite the same thing, but it gets your point across. Or using the opposite. You know, it's not hot. It's not hot if you're thinking of the word cold. That's a good strategy as well. Talking around the word, that's circumlocution, describing attributes. The function, it's red and it's round. You slice it up, you put it in salads. Oh, that's a tomato. Or the function, it's the thing that you drive, if you can't think of the word car. Those are all really great strategies that even if you can't think of the word, sometimes you can cue yourself, but at least you're cueing your listener as to what you're saying. Because the whole point is to keep the lines of communication going during a conversation. Use your listener, use the other people you're speaking with, your conversation partners, to help you out. And again, these things do happen to everybody. Use the first letter of the word. Oh, it starts with a B, starts with a J. Or think of the category that the word belongs to. It's a fruit. It's a fruit. It's a tropical fruit. It's that thing that's spiny, that grows in Hawaii. Another good way to either cue yourself or get your point across. So those are just some general word retrieval strategies that can be cueing you, but at the very least, keep those lines of communication going so you can keep the conversation going. Don't want to see you withdrawing from conversations. So the big question is when to get help, and Pam talked about this as well, and I will reiterate this. If it's really affecting your life, you're having difficulty finding the right words, if you're having trouble remembering what to do on the job or daily routines at home, or those things that used to be automatic are not automatic anymore, and it's really stopping you in your tracks. If you've been making some very poor decisions or difficulty making decisions and so you just don't make them, or have had episodes of showing poor judgment, that's an indicator that you need to have an evaluation and see a professional. Or difficulty keeping up with tasks or conversations. If it is having a big effect on you functionally, then please ask your physician for a referral to a speech pathologist. Sometimes you are referred to a neuropsychologist or an occupational therapist as well. And the one thing to remember, and the reason you want to remember this, is actually people with multiple sclerosis leave the workforce because of cognitive and fatigue issues more than they do for mobility issues. So this is actually a big reason people leave the workplace. And so it is something that you want to address sooner rather than later if it's starting to have a real effect on your daily function. How to get help is speak to your physician about cognition. Again, medications, fatigue, depression, and stress can all have an impact. And then start to think about what problems you're having in terms of function. How is it manifesting itself? A lot of people come in and say, I have a memory problem. Well, what has happened? And that really helps, you know, a speech pathologist like myself or Pam to go, oh, okay, this is really what we want to look at. Are you forgetting appointments? Are you forgetting words? And try to think about some examples of the things that are happening. And then again, consult a professional speech-language pathologist. We do not just speech and voice, but also language and cognitive evaluations and treatment. And an assessment can really help to determine individual challenges and strengths. And that is something then we can work on as far as targeted individual strategies and targeted treatment. Because early recognition is very important. You really want to stay as active and as functional as possible. So really being more proactive about this is a good idea if you're noticing that it's affecting your livelihood, your relationships, or your quality of life. And with that, I'm going to pass it back to Anne. And for questions.
Thank you so much, Janet. And we have a few minutes to take some questions. So I will go ahead and just call out these questions, and Janet and Pamela can help answer. So the first question I have is, in terms of cognition, when do you see a neuropsychologist versus a speech pathologist?
Well, it's interesting. Sometimes people, at least in my experience, have already had a neuropsychological evaluation by the time they come in to see me as a speech pathologist. I would say when it comes to workplace issues, very often with disability, people need to have a neuropsychological evaluation, which is a really long, extensive cognitive evaluation. It can be many hours over a few sessions to determine their disability, especially if they're applying for that for work. And just in my experience, seeing a speech pathologist is when, we also do cognitive evaluations. But definitely what I do is a focus on strategizing an individual treatment, on addressing those issues in a functional way about what can you do to actually alleviate some of those symptoms, either remediate them or compensate for them in some way. Pam, do you have anything to offer?
Yeah, I agree. And I would say that neuropsychologists do lengthy evaluations, and they look at how your brain and behavior and vocation and probably your mental health all combine. If you're looking for somebody to work with you to evaluate how cognition is affecting how your language skills are, how you're able to communicate, if you want to be able to strategize, speech pathologists will work on that area. So it all depends on what your desire is.
Great, thank you. We've actually gotten this question a few times tonight. There's so many of those commercials on promoting the Luminosity website. Would that be helpful in cognitive problems?
Lumosity.
Are you familiar?
The Lumosity website.
I'm quite familiar with them. Pam, how about you?
Yeah, just a little bit, so go ahead.
It's interesting. This has come up quite a bit, and it's been addressed in the past. Usually those, you get a little bit of free time on them, and then you have to buy into them. I think one thing with that targeted brain training, like on the computer, one of the big things that's missing, especially as it relates to communication and language and how most of us function day to day, is very few, if any, of the exercises or training has to do with auditory information. And that's really, when we're conversing with people, what we're using. There's a lot of evidence that proves that you can improve from your initial score to your later score on a Lumosity website or Brain Quest. But there's not a lot of research that backs up that is generalized to cognition and actual function, daily function in general. There actually is research that games that involve multiple cognitive processes, and an example would be like those Sims games or Rise of Nations, where you're actually putting together a civilization or something like that, it actually works better than doing an attention task where you're counting a bunch of bubbles going up the screen. So the one thing I say to people is, if it's something you really enjoy doing, then go ahead and do it. There's just not a lot of evidence that it gets generalized to the world in general and life in general.
Great. Another question we have is periodic hoarseness, can that be related to MS?
Well, I would say, this is Pamela, and I would say that it all depends on, in that case. Sometimes, just like you might have an exacerbation with MS and you'll have periodic transient things that come and go with you, sometimes you can have vocal changes, voice changes during that time as well. But you can also, it could also be related to having a cold or, you know, some other type of medical symptom, like reflux or postnasal drip or those kinds of things, and that's where a physician would help with that. And typically, if it's anything longer than, you know, probably a few days to a week, I would have you get together with a physician to figure that out.
Okay, great. And we'll take one final question, and that is, have you found that pain or dealing with pain can affect both the cognitive and physical aspects of speech and cognition?
I think pain can have just a huge effect on how anybody functions. It's stressful, and it really takes your attention away from something. So, you know, when you're having a lot of pain, it makes it very difficult to concentrate. And that's an attention thing. You know, when you can't attend because you are in pain, then it's going to be hard to really be on your mark cognitively and feel really sharp.
Great.
Yeah, it's kind of similar. It's one of those things similar to sleep. If you're not getting enough rest, it's one of those just basic needs. Then you can't pay attention, you can't learn, you can't remember sometimes. Similarly, pain would be in that category.
Great, thank you so much. And I apologize, we weren't able to answer all of your questions, but we will have an opportunity for that at a future webinar. I did want to thank everyone for joining us for tonight's webinar, and thank you, Pamela and Janet, for this presentation and for all the information you were able to provide for us. Before I do share the topic of our next month's webinar, I'd like to share with you some additional resources that you can find on Can Do MS's website. You can access our e-news archives, which is a monthly e-news article that features upcoming programs and events. You can also submit any questions that you might have, for example, questions that maybe you weren't able to get answered this evening, to our Ask the Can Do team, where the questions will be directed to our program experts and they will respond to your questions as soon as they can. And you can also access our Can Do library, which includes articles on health and wellness and lifestyle enhancement topics. I'd also like to share some information about our new book that we released titled Can Do MS, titled The Guide to Lifestyle Empowerment. It was co-authored by several of our program staff, and it was edited by Pat Kennedy. She's a registered nurse and nurse practitioner, and she's been working in the field of MS since 1987. You can purchase the book online, and you can also find reviews of the book on our website at mscando.org. And on October 8th, we will have a webinar that will be dedicated solely on answering your questions. So again, I apologize that we weren't able to answer everyone's questions this evening, but you will have another opportunity to have them answered. You can submit your questions for this webinar on our website. If you go to www.mscando.org/October, we will have 3 MS experts on the line, a panel of experts, and they will be able to answer those questions online. Please also don't forget to register for the webinar, and you can do that by going to our website at mscando.org/webinar. And our next webinar coming up, it will be on September 10th. It'll be at the same time at 8 p.m. Eastern Time, and the topic is Social Security, Understanding a Critical Safety Net. The presenter that evening will be attorney and physician assistant Thomas Stewart. So please join us live from the convenience of your own home or office at no charge to you. Again, thank you so much for those participating with us live tonight. And once this presentation is over, you will see on your screen a survey will appear. So please take a moment to complete that survey and share your input with us. Your feedback always helps us continue to improve our programs and webinars. Again, thank you so much for everyone's attendance, and thank you, Janet and Pamela, and I hope everyone has a great evening.
Thank you.